Today, we're going to be talking about combating anti-science and how to be an effective COVID-19 mythbuster. And so this is the slide on how to get your CME or CNE. No disclosures that I have. And again, this project is made possible by the Department of Health and Human Services, and we appreciate them and their support and the continued collaboration with Metro Health, UTSA, and other community partners. So today I want to go through the objectives for the session. We're going to do a little bit of defining terms. I then want to talk briefly about online health literacy, because part of what is contributing to our communities' sometimes confusion, ongoing spread of myths and misinformation, both online as well as in person and other sources. But I want to talk specifically today about how we can help people identify factual information online. Then I want to talk about some of the skills that we can use in interpersonal communication to help people, help us address those common myths and misinformation. One of those called misinformation inoculation. And then a few skill building techniques associated with health literacy and health communications. So today we're going to learn to help patients discern whether they are getting legitimate information online about COVID-19. We want to at least describe 2 to 3 common myths about COVID-19 or the vaccines that are circulating online. And then we want to learn to employ the skills of active listening and respectful bridging to practice speaking about COVID-19 myths. And if we've got the opportunity and people are willing to do it, we'd love to do some role playing with you today. There's nothing better than actually putting into practice what you learn the day you learn it. So I want to start with some terminology, either via the chat or if somebody is brave enough to unmute themselves. Who can tell me what information is? How would you define the word information? Anybody? I'll even take it from one of my panelists or other hub team members. So from Adrian, a set of words holding a meaning. Anyone else want to contribute to that? Knowledge that can be used to make decisions or take action, facts provided or learned about something or someone. Thank you. Perfect. Appreciate that. How would you define the word rumor?
I would say it'd be something that you hear from somebody or even on media, but you don't have a source, a credible source.
Yeah. So hearsay, as Dr. Berggren said, possibly not true from Guadalupe. Adrian says chisme, gossip. Yeah, I appreciate that. Secondhand knowledge spread to get a reaction, distorted or filtered information, generally biased. Interesting. Yeah, right. I mean, rumor has some sort of bias to it. I like that definition. So thank you all for sharing that. Now let's take it to myth. How would you define a myth? And is there a difference then maybe with rumor?
To me, a myth is more like deeply ingrained, right, than a rumor. So maybe it's something that is incorrect, but that is a belief held by a lot of people.
Yeah, Eileen agrees with you. She says it's a held belief. And then Andrea comes in with misconception, not totally rooted in truth. We got story, false belief, or information about something that is ingrained but not proven. Yeah, I like that, right? Because it's about mythology. There's a root there somewhere. And whether that is in truth or in fiction, we don't know. Okay. Misinformation. How would we define the word misinformation? Melanie says information that is not correct. Like that. Right, stuff that is not true but gets repeated due to a lack of understanding. False information. Yeah, Santos, I appreciate you jumping in. Yeah, and Mark, same information, purposefully omitting details. So I'm gonna challenge that one and see what people think. I'm gonna follow with what Santos put here: information that may be false, but not spread on purpose. I think that is the key piece on this. Is misinformation is false information that may not be spread on purpose, and then that brings us to disinformation. And I will just keep you without going to bated breath. Disinformation is that it's false information that is spread intentionally. Okay, yeah, exactly. You guys got it, nailed it on the head. So it's important that we think these terms as we go into this concept of myth busting, because some of the information that people are receiving is shared on accident. It is rumor, it's hearsay, but others, and a lot of it, particularly around COVID-19 vaccines, is intentional disinformation. It is being spread for a purpose to create confusion, to create anxiety, to create fear. And it's important for us to help our community understand this, because they need to ultimately make the best decisions for themselves with the information that they have access to. So you guys nailed it. Well done. Everyone gets gold stars. So let's go ahead and move on into some of the data today. So according to the Kaiser Family Foundation, nearly 8 in 10 people back in 2021 believed or are unsure about at least one common falsehood about COVID-19 or the vaccine. And so you can see here, they talked about a bunch of different ones, including the government is exaggerating the number of deaths, pregnant women should not get the vaccine, deaths due to COVID are being intentionally hidden. And so you can see that many of these in the dark blue have heard of and believe these statements to be true. Others have heard it, but they do not know if it is true. And then ultimately what they found was the net across all of these statements is that about 78% of people said they had heard at least one of these myths and say it is true, or they're not sure if it's true. So they're not saying they know it's false, they're just not sure. So we're up against an uphill climb to help people really find that factual information and make those best decisions for themselves. And in 2022, Dr. Peter Hotez published this brief kind of opinion and article about key considerations for communicating science. And these were his key takeaways that he was recommending to scientists, healthcare workers, those on the front lines communicating with the community, is that we have to understand first that anti-vaccine aggression is killing people. Over 200,000 people unvaccinated have needlessly lost their life during the second half of 2021. Many of those refusing vaccines are victims of disinformation. And while social media is oftentimes touted as the source of this, they're actually not the source. They are just the platform by which information is shared. And in fact, what Dr. Hotez and his team has identified, that disinformation arises from mostly 3 main sources. The first is the Disinformation Dozen. This is a term that I just learned about, which are non-governmental organizations and individuals identified by the Center for Countering Digital Hate. Go check that link out. It's quite interesting. And these include people like Robert F. Kennedy Jr., Joseph Mercola, who's an osteopathic physician, and Ty and Charlene Bollinger, who are misinformation peddlers, as they are described. It also includes state actors, including the Russian government, and finally, the political extremes in the United States. So these are the sources of this misinformation and disinformation that then gets spread online via social media platforms, and oftentimes then amplified by the mainstream media and then through interpersonal communication. So we're up against this uphill battle. And while we can't necessarily always address those sources of misinformation and disinformation, what we can do is help our community navigate the online environment to see, are they getting factual information? Is it a trustworthy site? And understand how they may be getting manipulated by social media sources. And that's what I'd like to share with you in this phase of this session of the presentation. And so there's this program that was developed by the colleagues up at University of North Texas called Web Lit Legit. And it's a real simple acronym that helps people understand what a website is giving us and how to assess its reliability. L stands for, is it up to date? When was the last review? To know if a website is trustworthy and if their content is useful, make sure that they've got this was last updated on such a date. If not, then you should question whether or not that is a reliable source. You have to then ask yourself, why does this website exist? Is it selling me something? Is it trying to promote something? And then oftentimes you can think about who is behind that, because then it leads into this idea of, gee, is it good? Is it a credible source? Can I trust this source? Should I trust this source? And then you got to look at the I, which is the information source itself. Are they citing research? Is it research-based or is it opinion? Many places will tell you that this is an opinion article. Others will just simply say, COVID-19 kills, and then they put a whole bunch of information. And then the onus is on the reader to determine whether that it has scientific base or it is the writer's opinion to it. And then the final part, the T, is have to ask ourselves, is this too good to be true? Is what they're telling me either too bad, right? Because oftentimes it gets way amplified in the negatives, but oftentimes the positives also can be amplified way too much. And so these are the questions, LEGIT, that people can ask themselves as they're looking at websites to determine, is this website legit? And the simplest way is it up to date? Is it a credible source? And is it coming from a scientific base, or is it somebody's opinion that they are promoting online? And oftentimes we can think about whether websites are legit based on just their final piece, right? The link at the end, the ORG, the GOV, the EDU. Those are oftentimes more trustworthy than others. And that is because they are professional societies and affiliations, because they are governmental agencies, because they are institutes of higher academic learning. The sites that we have to be a little bit more wary of are the .coms, because those are commercial businesses often. And we just can't be necessarily sure of where those sources are coming from. And it requires a little more due diligence on the part of the reader and the user of that content. But again, even with the .orgs, the .govs, and the .edu, everyone should be looking, when was the content last updated? What are they telling me, or what are they trying to sell me? Is there an agenda behind their message, or is it just the data and helping people make decisions? So that's a real simple tool that we can use in our everyday conversations with people. Ask people, check the legit. When was it last reviewed? Why does it exist? Is it good, credible source? What is the information source that they're using? And is it true or too good to be true? Before I go on to myth busting, I did want to just introduce everyone to this game called Get Bad News Game. And what's interesting about this is that this is a game to understand how people manipulate us on social media. And so as you go through it and you try to spread bad news, which is just a fake engagement, they highlight these different ways that people on social media take advantage of users. Polarization, finding existing grievances and blowing them up, driving wedges between people. That's a technique that is oftentimes used on social media. Trolling is evoking an emotional response, anger, irritation, sadness, really pushing hard to get people to find that emotional response and then push them in one direction or another. Discrediting people is a really common use on social media. Basically, if you don't like what they're saying, strike at their credibility. Find something that will make people question whether or not you should trust them. And I think Dr. Hotez probably would talk about how he's have attempted at discrediting him and his colleagues around COVID-19 vaccines. Emotion, a lot of times on social media, people will play into fear and anger and compassion to get your message out there. Really diving deep into conspiracy theories. There's a lot of that going on these days, trying to uncover the quote unquote truth. People are always looking for that. And so social media can really help drive a wedge there. And then finally, impersonating somebody. So these 6 steps are what people are using on social media platforms to spread disinformation, to create confusion, to create fear, and ultimately lead to a lack of trust in science. And so there is a responsibility for us as consumers to try to understand, where is the information coming from? Should I trust it? And can I verify it from another site? Ideally, would be another step that you can take. So once you've helped people kind of understand what they can do in the online environment, you also have a responsibility, I think, in that interpersonal communication. And this is where the myth busters come in. I don't know else watched Mythbusters, but this was one of my favorite shows. I just love what they do. And this is the same idea, but we do it respectfully. And our goal is really to engage with trusted sources. We know from evidence that people are going to listen to those that they trust and respect. Physicians, nurses, community health workers, pastors, and others. If we can bring together the coalition of the willing of those that are trusted, then we can begin to push back against myths and misinformation. The other key principle is keep it simple. Don't overwhelm people with technical knowledge, and break that technical knowledge down into bite-sized chunks that everyone can understand. And then third, and we're going to talk about this in a little bit more detail later, is respecting perspectives. Even if you don't agree with what the person is telling you in front of you, you need to respect their opinion and validate that it is a way of thinking. Now, before I dive into the interpersonal communication, I did want to just share a little bit of the current evidence about which types of techniques have been proven most effective at helping people address myths and misinformation. There's 2 studies just recently published this year looking at 3 different approaches to text-based myth busting using question and answer. So basically, does the COVID-19 vaccine cause COVID? And then providing the answer, no, it does not, because it does not have live virus. Providing just the facts, or providing the fact and the myth together at once. And so these are the 3 types of things tested in 2 different trials in the UK and in Australia. And what they found was that the question and answer and posing questions were the most effective ways of helping to address COVID myths and misinformation amongst populations. And interestingly, they found that there was no backfire or negative effects of repeating the myth. Because, what I've been hearing for 2 years now, and many of you have probably heard the same, is don't repeat the myth. Every time you repeat the myth, it gives life to it. It breathes life into it. But what they found in these studies was that, in fact, it didn't really matter, because what you could do is reinforce the fact or the truth with your statements. And so I just thought that was interesting, and wanted just to show some of the evidence that is out there about these different communication techniques and styles. So the question and answer proved to be the most effective way at helping people address and understand the facts associated with the myths that they were sharing. So the UNICEF published a field guide on addressing misinformation pretty early on in the pandemic, and they promoted this idea of misinformation inoculation. You don't have to wait for somebody to come to you, standing in front of you that day, to say, for them to present a myth to you. You can actually inoculate them. You can prepare them for some of these myths and misinformation ahead of time. And the steps that they promote is this idea of present the fact first. Then warn them, here comes the myth. Here is what you will hear that is against this fact. And then your job is to explain to them, here's the fallacy. Here is where they are trying to spread this misinformation or disinformation, what lever they're trying to pull, what fear or anxiety they're trying to leverage. And then you follow it up again with statement of fact. And I just want to share one brief example here. The fact is, COVID-19 vaccines do not themselves cause COVID-19. The warning is, you will hear many people say that you will get COVID-19 from the vaccines. There is no need to then get vaccinated, because I'm just going to go ahead and get it anyway. The fallacy is a misrepresentation of the way that vaccines work. And this is misinformation that's targeting people's fears about a new vaccine and how they operate. And then finally, you land back on the fact the vaccines cannot make you sick. The mRNA vaccines do not have viral particles in them. They have the instructions on how to build the spike protein, not the virus itself. And then our body uses those instructions to create immune response. And so, in fact, it is not possible for us to get COVID-19 from the mRNA vaccines. So one piece to highlight quickly is the fallacy is you should highlight the reasons why it is being promoted. Don't just say it is being promoted, but why? Is it leaning into some long-standing within a certain population? Does it have something to do with your faith or political orientation? Because again, thinking back to those social media levers, people are always pushing and pulling these levers. And we need to help people understand how they may be getting manipulated emotionally or otherwise. And then finally, your final fact, you need to replace that misinformation or correct it. So when engaging in interpersonal dialogue, there's 2 key messages that I want to promote today. The first is active listening. You have to show whoever you are talking to that you care and that you are engaged. So that means put your phone down, turn away from the computer, make eye contact, and show them that you are actually listening to them. A key piece of this, and my wife reminds me of this all the time, is don't seek to win the conversation. If you go into the conversation saying, I'm going to win, you have already lost, because you are not going to get them to where you want to go. You need to seek to be curious. Ask them questions, learn about the why of what they're feeling and where they're getting their information from, and don't judge them. Use summarizing techniques, reflect with them, ask clarifying questions, and use positive body language. And you'll find that you'll get a positive response and be able to help them move along this pathway towards understanding or identifying more reliable information sources. And then the second tip is respectful bridging. So as we were acknowledging perspective, as we were actively listening to the information that person is sharing with us, we need to first, like I said, acknowledge that, yes, I've heard this from other people. This is a valid way of hearing. You do not have to agree, but then you've got to respectfully bridge to a fact that you would like them to hear. And that's what these bridging statements are. And so you don't just say, I don't agree with you. You then say, yeah, that's interesting. You know, I've heard that from others in my patient practice as well. I can't tell you much about that because I'm not sure of this thing. But what I can tell you is that the vaccines are safe and effective. One of the key pieces that I want to emphasize here is beware of the but. We oftentimes insert but into our responses, being unaware of the fact that when we say but, we negate everything that we just said prior. So Dr. Kemp, I hear that you're saying that the vaccines have a chip inside of them. And I say, well, you know, I haven't heard, I don't know if I agree with that, but, and then all of a sudden you now negated that thing that you said before. And so we have to be careful. And is a perfectly good conjunction, gets you to the same place. And we may not think that it matters and that people hear us, but they do. And so I just want everyone, if there's one thing you take away from this, be careful of inserting that but into your response, because it will be heard, it will be felt, and it may end the conversation at that point. So some of these bridging statements are outlined here. I'm not an expert in that, although we are all many experts in many very different things. No, let me try to explain this, and the most important thing to remember is this. So, you know, I hear that the COVID-19 vaccine will give me COVID. And you could say, you know, what most people don't realize is that the mRNA vaccines don't actually have virus particles in them. They have the instructions for creating the spike protein. So you didn't tell them that's false. You didn't tell them that they're crazy for believing that. You acknowledged that thing, and then you went into the fact that you wanted to land on. And so if you're ever sitting there thinking, well, what is the fact? Here are 5 key messages for COVID-19 vaccines that you could always land on using your bridging statements. The COVID-19s will help us stop the pandemic. The vaccines are safe and effective. They are free. The vaccines may have some side effects, but those are normal signs of our body building protection. And even if we have been vaccinated, we should still wear our mask and practice social distancing. So these are some real simple techniques. I don't think I'm teaching anything new or innovative in this session, but just helping us think more creatively about how we can have conversations with folks using active listening, using those bridging statements to get from a myth or misinformation to a fact that we would like people to hear. And then this idea of misinformation inoculation, helping people prepare themselves for what they may hear online or on the news articles or from their uncle's brother's child, who we know that many people are getting their information from as well. And so these are some simple techniques to help us get through this. These are some common myths and misinformation that I know I have heard when I'm out there talking to the community. Some of these have been submitted by friends of ours, that COVID-19 vaccines will cause infertility, that the deaths are miscounted and overinflated, that it's being used for population control and genocidal effort, and that the vaccines will make you sick with COVID. And I'm looking forward to looking through these scenarios with you. And if the opportunity presents itself, I would love to do some role playing with you, trying to use active listening and respectfully bridging statements. And with that, I'm going to wrap it up. And thank you so much for your attention and for the time to talk to you today.
Thank you, Jason. That was really outstanding, and lots of helpful tips in there and lots of stuff for us to unpack. As we're waiting for people to populate the chat with their questions, I'm going to ask one. You had a list of techniques that included the misinformation inoculation. You really unpacked that really well for us. But prior to that, you mentioned the question and answer technique. I was wondering if you could unpack that a little for us, even maybe give us an example.
Yeah, and I was hoping that wouldn't be confusing, but I wanted to make it clear that the evidence around some of these techniques is kind of hard to gather, particularly in interpersonal communication. And so the studies that I presented was text-based approaches to addressing myths and misinformation. And what those two studies found was that the most effective way for helping people understand and address myths and misinformation was a question and answer approach. And so the question would be, well, do COVID vaccines cause COVID-19 illness? And the answer is no, the COVID-19 vaccines do not cause COVID-19 because they don't have COVID-19 virus particles, just the mRNA proteins to help develop the spike proteins.
So it's a repetition of the myth, but in a question form.
Exactly.
And then you told us that doesn't backfire. The evidence is that that won't backfire.
And that's what they found, is that the repetition of the myth in these two studies did not contribute to the perpetuation of those myths. In fact, it helped people understand them better.
Thank you. Folks, I know you must have other questions for Dr. Jason Rosenfeld. And while I'm encouraging you to put those in the chat, I'm going to give the microphone over to one of our hub team members, Andrea, who is going to make a quick announcement.
Yeah, we're getting a report that the CME activity code may not be working for all people. It's not something we can fix real time, but here's what I want you to do. A little bit later in the session, Carly is going to chat out the link to complete our post-session REDCap questionnaire. If you are looking for continuing education credit, fill that out. And then we'll follow up with the Office of CME to make sure that everybody gets the credit that they've earned for being here and participating in today's conversation. If any other hiccups come up, please do also email us and the Confianza team. We want to make sure you get your credit. Back to you, Ruth.
Thank you so much. Thank you. So we have a question in the chat from one of our panelists, our extraordinary community health worker, Ludivina Hernandez, whom we call Ludi. Ludi writes, what do you suggest community health workers answer the question, Johnson & Johnson news with our community? Ludi, do you want to unpack that question just a little bit for Jason to answer?
Yes, so as everybody knows, the news that we received from the Johnson & Johnson and that, that it may not be the best option for our community, and knowing that a lot of our community members like in the west side and the east side, they were given this option because it was a one-time, treatment, and a lot of people, that's the reason that they seek this. But there were, a lot of people were concerned because they were saying that, like maybe in the north side it wasn't offered as much, or it wasn't used as much, and it was offered in our west side community and our south side and east side communities. They were pushing this vaccine, and because we felt that it'd be better for our community members to have at least one vaccine, so we kind of agree with that. I said, okay, well, if it'll be easier for our community members to have this one vaccine. So now that this news came out, how do we explain that to our community members, and how do we have that conversation?
Excellent question. And it gets right to the root of what we're trying to address with Health Confianza, which is health inequities. And we're trying to seek ways to use health information and knowledge and health literacy to address and remediate the health inequities that we're seeing in our communities. So a very serious question, Ludi, a tough one to grapple with. And I'm going to let Jason Rosenfeld, our presenter today, take the first stab.
Yeah, I appreciate it. It is a tough one. And the way that I've tried to answer this question when out and doing community education or outreach work is I try to encourage folks that the best shot is the shot that you get. And that while we dwelt early on these efficacy numbers that in fact the efficacy of the Johnson & Johnson vaccine, at least when it first came out, was still really quite high. I believe, if I remember correctly, it was around 60%. And it might have been more. I think Ruth, you can correct me if I'm wrong on that. But that's still really high compared to other vaccines, right? And then what we found is even with the boosters of Johnson & Johnson, that it gets us, so the Johnson & Johnson data in terms of hospitalizations and death is almost on par with Moderna and Pfizer. And so I try to just encourage people that the data is out there, that it is as effective as the other vaccines. And in fact, it may make it easier for folks because it is the one and done.
Well, the updates to that, of course, is that as time has gone on, we've learned more about it. And, there were side effects associated with Johnson & Johnson, particularly a dangerous type of blood clot that only affected women of reproductive age, that made that less desirable for that age group. That was not known at the time the vaccine was released. And so here's the truth. The truth is that this vaccine looked really good when it came out. We believed it was a one and done vaccine, but as it got rolled out, we learned some things about the vaccine that were not known at the beginning. And we now know that it is not a one and done vaccine. In fact, the Johnson & Johnson does require boosting, and your first boost can be with the J&J, but it can also be with an mRNA vaccine. But we now know that your next boost should not be with J&J, and those J&J people should be getting subsequent booster doses with an mRNA vaccine. So this is awkward, folks. I mean, it's true. We went out and we targeted populations that we thought would have difficulty getting for recurrent vaccinations. And we said to those populations, this is really good for you because it works and it's one and done. And then, P.S., it turns out none of the vaccines are one and done, and the J&J has some safety issues for a very particular group. How do we go back to those populations targeted, like Ludi outlined, and say, here's what happened, here's why, and here's what we think we should do? I'm going to ask Dr. Kemp to jump into this conversation now, because I'm sure he has some thoughts about this as well.
Thank you, Dr. Bergen. Well, first of all, I think it's important for those of us who work in those communities that we're upfront and honest about what has occurred. That's important. Second thing is, when I first found out that there were some issues with the J&J vaccine, I'm going to tell you honestly, Dr. Berger, I told our people don't administer J&J. I just told them not to. I said the vaccine that we should be advocating for here should be an mRNA vaccine. And I'm talking about at Antioch Church. So that's what we did. But that was after we discovered that there were some issues, particularly with the blood clots. And so I was just concerned about that. Well, now at this point, I think what we have to do is say to those people who need a booster that it's better to get an mRNA booster at this point, and try to encourage people to come back and get the booster. So one of the big problems we have in our community now, last I checked, Metro Health was reporting about 25% or so of the population has gotten boosters. And that's an issue. We have to convince our population that it's important not just to get the primary series, but also to get the booster. So that's how I would approach it. Whether right or wrong, Doc, that's how I do. That's how I would do it.
No, I can't think of anything that would be wrong with that approach, Dr. Kemp. It's just, it does put us one behind, right? Behind the 8 ball in our goal of confianza, of repairing trust, which was already fragile even before COVID, right? There was some fragile trust about vaccinations or new things when it comes to medicine. So we do have, I think we will not overcome this unless we're intentional about it and proactive. But it is true for Ludi, if you are a person who got the J&J vaccine, if you're following the guidelines about boosting, getting your second dose and then getting the booster dose, which is recommended to be an mRNA vaccine, there is good evidence that you are getting protection that is meaningful, and you greatly reduce your risk of having a bad outcome from COVID, such as needing to go to the hospital.
Let me just say,
Yeah.
I'm sorry, Dr. Berger, I hope I didn't
Yes.
interrupt.
No, please do.
What I'm saying is that because things evolve, the data evolves, we also have to be honest with our populations and say, we're learning. And what was true a few months ago is not true now. And it's not because we were trying to be deceptive, it's just simply because more data has been acquired over time.
And that's true in this case and in many other aspects of COVID management and prevention. All right. Well, thank you, Ludi, for just going straight to the heart of something really important to this Health Confianza effort. I now want us to turn to a PowerPoint, and I'm going to ask our IT support, Carly, to please bring up this PowerPoint, which has case scenarios. And so, folks, last time we met, I showed you the case submission form. We took a little different format this time because we had requested people, primarily community health workers who are out in the community, to share with us what they're hearing in terms of mythbusters, and not just tell us the myth or the misinformation, but give us the context around it. So if you would advance the slide, please. We're going to start with the first scenario, which was actually submitted to us by Gracie, one of the community health worker and outreach coordinators, actually, who works with us here at UT Health as part of our Confianza team. Gracie, would you like to tell us about what happened in the Walmart parking lot when you came out to your car? Are you available to come on screen and talk to us? Thank you, Gracie.
Okay.
What happened?
We walked out after we left the Walmart. We went to our vehicle. There was a note. It was nicely folded. And I noticed that all the vehicles around us in that area of the parking lot had the note. And we looked to see if there was anybody around before we even opened the note so we can, find out who was doing it. And nobody was around. So, it was a letter. It was a letter saying why we should not be vaccinated. And
Gracie, I'm going to interrupt you for just a second because I believe we may have a picture of that flyer. Carly, can you advance the slide? Here it is. Gracie, I know I don't see you, but can you see the slide?
Yes, I can. Yes, okay. I can.
So you can talk from the slide, but folks, this is an actual picture of one side of the two-sided flyer that Gracie and everybody who came out of Walmart that day found this flyer on their windshield. Do you want to tell us a little bit, just a few details?
That day, Walmart was doing some screenings inside, some health screenings, and I'm not sure if they were doing the vaccinations also, but they had a special event for that. So I think this is why someone went out there and started advertising and putting this in the vehicles. Nobody was inside Walmart trying to stop people from doing the screenings. So.
All right, this is pretty potent stuff. This person alleges that we are witnessing the first global mass murder being led by Satan's team on the planet. Big, bold font, exclamation point. It goes on into stating a bunch of misinformation and outright lies that millions of people are dying from the vaccine itself. They're using incomprehensible combinations of letters and numbers and saying without any evidence or definition that these are toxic substances, and describing how these compounds get into various parts of our bodies and into the ovaries, reproductive organisms, and that these spike proteins are causing damage to our cardiovascular systems. So this is tough, and someone just leaves these flyers on our car windshields in the Walmart parking lot, and there's nobody to talk to, and it seems a little bit impossible to know how one would respond in a productive manner. So I'm going to throw this to our presenter first, Dr. Jason Rosenfeld, to get his thoughts, and then see what some of our panelists have to say about it as well. Jason?
Yeah, I mean, the challenge with this one, right, is that it's a anonymous space. It's just a piece of information been thrown at hundreds of people as far as we know. And for me, there's not much that we can do in the instance because we don't know who the individual is, but there is a lot that we can do collectively thereafter to prepare people to say, hey, you're going to hear this, very much along the lines of that misinformation inoculation strategy, that you're going to hear this. And in fact, here is an example of it. And let's unpack what fear it is that they are trying to leverage and tap into through this methodology, and how can we collectively address it as a community. So I would tackle it through a misinformation inoculation.
Right. So thanks and kudos to Gracie, who actually brought this flyer to us, because if we're not seeing what the actual myths are that are in the community and how they're being transmitted, we can't then use that knowledge to inoculate others against the misinformation. Melanie Stone, we haven't heard from you. Melanie is a health literacy expert, and she's got her hand up, so I gather she's got a comment to make about this.
I do. Thank you, Dr. Berger. And I was just going to say this flyer is an example of some sophisticated techniques for misinformation, and the fact that it looks very legitimate, right? It looks like it has some real facts in there. It has high-level language, so it's targeting people who have lower health literacy and lower literacy skills because they may just skim over that, but it looks like it's something that is very scientific and scientifically based. One suggestion I have when you're talking to people, if you had something like this that you were talking about, is drawing an analogy from this digital health literacy, or well, this is not digital, but this health literacy issue to a financial literacy issue. So there's a lot of talk in the community about people getting scammed, with also people using very sophisticated scamming techniques and preying upon people's trust in things like this and hoping that they're not going to check it out in detail. And so if you were talking to someone about this, you could also relate it like, well, what would you do if someone came to your door and tried to sell you something or ask for your credit card number? Because that might resonate with people a little bit more than the health, literacy would. So that's just one suggestion I had.
And that sounds like a variation also on the question and answer approach. Like as you're trying to help debunk a myth in somebody's mind, that you use the technique of asking a question and having the person pose themselves that question as part of your persuasion. Dr. Kemp, wearing your other hat as the senior pastor of Antioch Baptist Church, I'm calling on you to help us here. This person starts out very angrily and invokes Satan. What would be your thoughts about how just regular people in the community, the others in the Walmart parking lot who come out and see this on their windshield, how could they respond in a positive manner?
Yeah, so obviously this is playing on the fears that some religious people might have. Some people who we might term as hyper-religious, if you want to look at it in that way, where everything is because of Satan. So we have to encourage those who perhaps may have been thrown off by this about their faith, the tenets of their faith, and that sometimes people will use faith as a measure to prevent people from accepting good information that's scientifically based. It's not always an easy thing, particularly if people are just really locked in to their ideas of God and Satan and the minions of Satan, if you will, as this communication attempts to do. But we have to draw people back to what their faith is established upon, and not allow someone to misrepresent that.
Thank you, Dr. Kemp, for those thoughts. Ludi, did you have any thoughts about this flyer situation from your perspective as a community health worker?
Well, there's going to be people that they see something in print like this, that's gonna in like the pastor was talking about, looking at Satan, thinking about, this is Satan's work and things like that. But unfortunately, there's a lot of people that would be scared by this and would be affected by it and change their opinion. So it's not good to see, because I feel that some of our people may be, persuaded to think differently.
And what would you think might be helpful? We all agree it's a problem. We're with you. We think this is going to scare some people. Not everybody's going to read it and throw it away.
Unfortunately, we I don't know what we could do, because we don't know who got this this literature and how would we approach them. But if it was brought to me, I would try to use some of the information that I've gathered as a community health worker and cite some of that information to try to address what's being said in this letter.
Well,
Dr. Berger, may I add
please
this?
do. Go ahead.
We know early, and I think Dr. Rosenfeld mentioned this, we know that you have to engage people who are trusted in the community. And so if this is being blanketed in a certain region, it may be necessary to ask faith leaders to weigh in. I think it's extremely important for faith leaders to help in spreading the right or the information that's going to benefit the community, as opposed to perpetuating misinformation or disinformation in the community. So, I really believe that the faith leaders have to be engaged.
And to that point, the pastor in our church did address that the church was supporting vaccination and the boosters, because there was a lot of concern from our parishioners as to, should we get vaccinated? Is this something that the church approves of? Or so it is true that it makes a difference when religious leaders speak to that.
So in the chat, I'm seeing a few pointers. One in particular that's really useful I'm imagining I'm a person in the Walmart parking lot, and I see people next to me kind of freaking out when they see this on their windshield. The point is made that this is totally anonymous. So, and Jason put that a key point to emphasize when talking with others about a resource like this is to point out, why would you trust something that's coming from a faceless, identity-less source? Credible information comes from an identifiable source. So this has no identifiable source. It's anonymous. That should be a clue that it's not going to be reliable. So that doesn't fix everything, and it doesn't exclude the need for what Dr. Kemp just said, which I think is so important, to get the faith leaders on board to help with this sort of thing. But it's a little tool that each of us can have in our back pocket. All right, Shalisa says, including faith-based leadership is a great partnership with the community health program, and we couldn't agree more, and that's why we're so lucky to have Dr. Kemp, who's both a doctor and a pastor, and he's with us here today. Let's go to the next slide, please, Carly. We have a scenario that I believe was submitted to us by Ludi, right, Ludi?
Yes.
You want to tell us about this one that took place in a community space at a family gathering? Tell us about it.
So this is in my family. So one of our older family members, when she was part of the conversation that came up about vaccines and getting boosted, she came out and said that she didn't believe in vaccination, that all we needed to do was eat healthy, sleep well, take certain supplements that she thought would work for this, and that as proof, she was saying, "Look, I'm 89 years old. I've been healthy through all of this, and so you don't need to be vaccinated. All you need to do is is do the simple things that are just, being healthy eating, sleeping, and taking your supplements, and that'll get you through.
So my first question for the audience would be, is this disinformation or this misinformation that's being shared in a community space, as it were, in a family gathering? Is the grandma deliberately trying to mislead people? So Katie, thank you. This is misinformation. She believes what she's saying, and she has everybody else's best interest at heart, right? So how do we bridge respectfully from acknowledging her different perspective, which comes from a place of good intentions, but is not true, is not the whole truth? I mean, it is good to eat healthy. It is good to sleep well. If you're doing all those things, you're going to be less at risk for a bad outcome from COVID, but that's not the whole story, because there are people who will not fight the virus off without vaccination. So what are some techniques that we could use in this particular scenario, Jason Rosenfeld?
Yeah, I love the idea of congratulating and reinforcing the positive behaviors, right? I mean, well done. So glad to hear that you're eating healthy and getting good rest. And I would like to encourage you to consider the vaccine to really boost that immune response so that you can actually reinforce all those positive things that you're doing. That's one way. I mean, it depends on where the conversation was and whether or not there was an openness to a vaccination or if it was to talk about other preventive measures. But I would start the way that Ludi responded, which is well done. Like, so glad to hear you're taking care of your well-being.
Melanie Stone, other comments to add to this approach?
Yeah, I think she probably exhibits the typical mother instinct where she's not so worried about herself, but you could, I'm sure she's worried about her family members, her friends, her community members, church members, and, maybe bringing up some of the people who is in her circle who may be immunocompromised or may not be able to get the vaccine, who would benefit from other people having it around her. So having that circle of community to keep that person safe. So I would probably draw upon examples of people who are in her circle who probably, maybe even the young children, the babies. So that might motivate her to think about getting it, to help other people.
And then the second part of what was in Ludi's response that she shared with us was pointing out the other things that grandma had been doing that grandma was not crediting, right, Ludi? You point out that she was also wearing a mask. She was also not going out and exposing herself to large groups, and pointing out to her that she had done those things too, and that was contributing to keeping her safe. How did she receive this information from you, Ludi?
Well, the other thing that we had that I did not mention, I told her that because she was able to stay at home and she doesn't get out much, but the other members that have to go to work and have to be exposed, that's one of the reasons why we should all get vaccinated, because we're having to go out there and out in the world where we don't know who's what we're getting exposed to. So she kind of agreed, and she said, but not totally, but she was okay with it.
All right. Well, thank you. We are up against the hour, so I wish we could keep going. There's some really good comments in the chat. Please look them over. Melanie Stone has some additional digital health literacy resources for us. Melanie, did you want to paste some of those in the chat, or should we send them to our learning group afterwards, or both?
Probably, since we're out of time, I can send this to our ECHO team to have them send out. These are some resources that you can use in your practices, to handouts to give to patients about digital health literacy, and also some curriculum if you want to do some teaching yourself, or if you want to employ your librarians or community health workers or even community service learning students to help you actually engage in some curriculum with the patients and community members.
So just to pick up on that, Melanie, if somebody in this audience wants to have some help with their place where they're providing care, to improve the health literacy environment, they can reach out to us. How would they do that?
I would suggest they use our Confianza email, which has been circulating. Mia, would you mind putting that in the chat for everybody? Please reach out to us and tell us what your needs are, and we'll see how best we can help you, whether it's us doing the trainings for you or connecting you to some other resources.
And I see that Mia has also put at least 5 URLs in the chat, each of which is a website that we endorse that can help us explain digital health literacy concepts to our patient population. All right, well, we are going to have to close. I would like to give the baton one more time to Reverend Dr. Ken Kemp to see if you have any parting thoughts for us. And I also want to remind everybody the next ECHO session is May 20th, 2 weeks from today. Dr. Monica Verduzco Gutierrez, who's our chairwoman of the Physical Medicine and Rehabilitation Department at our medical school, is going to talk to us about long COVID and post-COVID syndrome. It's going to be a really important session. I hope everyone will come back for it. And now back over to you, Dr. Kemp, for some final closing thoughts.
I just want to say thank you to all who helped put this together. Dr. Rosenfeld, thank you, Dr. Bergman, for leading us. I wish we had more time because we had a whole lot more we could say. But we have run out of time. Let me just say this to everyone: treat people with respect. If you start there, then a lot of this stuff will get taken care of. You have to start with respect. Even those people who don't agree with you, you have to respect them, and then maybe they won't scream at you at the end of your encounter.
Thank you for those words of wisdom. And thank you, each of you, for being with us. Ludi, Melanie, Jason, Dr. Kemp, excellent, excellent session today. And with that, I turn it over to our ECHO Hub.
Thank you. Thank you so much. This was an excellent discussion. Thank you so much for your participation. For those that put a message in the chat, thank you so much for the didactics and for all the panelists today, for our hub team. Thank you so much. So please check out your emails. You want to receive information about the CME, CNE, and the credits for ethics, continuing medical education. And our next session is going to be Friday, May the 20th. We look forward to see you here. And until then, please take care. Have a wonderful day.